Well, good afternoon, everyone. Welcome to our daily COVID-19 update briefing. I'm joined today by Dr. Amal Tokars, our Assistant Director at the Illinois Department of Public Health, Dr. Omer Badaman, Director of Infectious Diseases for Memorial BJC Hospitals, Margaret Blandford, the Deputy Director of the St. Clair County Health Department, and Herb Simmons, Director of the St. Clair County Emergency Management Agency. We're here in Metro East. Two of our senior elected leaders are here also with me. I want to thank Chairman Mark Kern of St. Clair County and Leader Jay Hoffman, who has been a great partner in Springfield in helping to protect the people of Illinois 19. So let me start with some in the testing department. Illinois is now averaging over 70,000 tests per day. And as of this morning's report, we now have more than 7 million totals since the beginning of the pandemic. A milestone reached just 2 weeks after we crossed the 6 million mark. That means here, like in many other states, there is a test available to you at no cost if you need it. The testing center nearest to you at dph.illinois.gov/testing. I'm going to say that one more time because I do want you to go there and find out where you can go to get a COVID-19 test. dph.illinois.gov/testing, and you can address in and find the nearest location to you to get a test. We gather today as Metro East's neighbor to the east, Region 5, enters a period of stricter mitigation in response to a surging positivity rate, now at 9.1% as of this morning. This comes as Region 5 saw a sustained rise in COVID-related hospitalizations for nearly 2 weeks. These mitigations are not fun for anyone, but they're meant to protect people, support our healthcare workers, and save lives. Just like stoplights and seatbelts make our roads safer for everyone, or banning smoking from airplanes and restaurants when science demonstrated the harms of secondhand smoke. So many times throughout our lives we are met with challenges, and from seatbelts to signage, we find ways to manage and to overcome them. This pandemic is the greatest challenge that many of us have experienced in our lifetimes. And when it comes to managing this pandemic, these are our best tools to find our way through to the other side. As more and more studies continue to show, this virus is primarily conveyed through respiratory transmission, person to person. And situations where people are more likely to see that transmission, singing, talking loudly, speaking without a mask, take on a greater concern when we're seeing high rates of community spread. These mitigations aim to cut down on those high-risk activities until we can bring down the positivity rate in any given area. It's really that simple. We want to restore as much normalcy to people's lives as possible. But that can keep it there. The way we do that to create a safer, more open landscape so long as we're living in this pandemic. That's how we keep our economy moving forward and get more of our kids. And to reduce the impact on our bars and restaurants in the meantime, our Department of Commerce and Economic Opportunity is giving priority consideration to small businesses in regions that have earned additional mitigations in our business interruption. And you're a bar or restaurant or a business that's been affected by the resurgence mitigations that have been applied, you can EO website apply for a business interruption grant, and we will prioritize. I say all this today because here in Region 4, things have moved once again in Metro East, because I want to make sure all of you know that didn't happen on its own. That this community put in the effort to make that happen. Unfortunately, the average of 5.8% at average positivity rate, 2 full percentage points in as many weeks, and it's rising. In other words, Metro East, it's time to step up and mask up. The work is not yet over. Nobody wants to go back to tightened and heightened mitigations. We have our elderly, our immunocompromised family members, our frontline workers, and our healthcare carrying an undue burden of risk. We have got to get this under control. Before I turn over the podium, I want to provide a brief update on the metrics of Region 1, Northwestern Illinois, where Rockford is, where Freeport is, which has been under Tier 1 of our resurgence mitigation plan since Saturday, October 3rd. Over the last few weeks, Region 1 has continued to see a resurging positivity rate, 11.9% as of this morning. We've said all along that if things don't turn around in a region after 2 weeks of resurgence mitigation, to add more stringent measures to help usher in the progress that we need to see more open again eventually. That is now the case in Region 1, which has seen its positivity rate rise nearly 2 percentage points since October 14th alone. So starting Sunday, Northwestern Illinois will need additional mitigations, such as tighter gathering caps of 10 individuals instead of 25, and new restaurant and bar table caps of 6 instead of 10 when eating out. The existing mitigations that were already put in place in early October will remain also. Both Region 1, bordering Wisconsin and Iowa, and Region 4 here next to Missouri, carry the additional responsibility of navigating a situation where the massive surge of cases in our neighboring states will continue to have a spillover effect. There is no easy fix to this. So as colder weather comes upon us and brings flu season along with it, it's imperative that we take extra caution and extra care. Because at the end of the day, this is bigger than you. This is about all of us and the communities that we call home. Wear your mask, watch your distance, wash your hands, and get your flu shot. We have to. Over to Dr. Amal Tokars, again, the assistant of the Department of Public Health. Doctor?
Good afternoon, everyone. Can you hear me? Oh. First of all, I want to thank all the people across St. Clair County who work and support public health for the people of your communities, and I also want to be grateful in front of you for all the people in Illinois who are doing this. It's a lot of hard work. We are, as the governor was saying, very concerned about the rise, and we use the word a rise in sickness amongst our brothers and sisters. We're seeing a rise in sickness that is serious enough to land people, and we know that's very serious if they're getting there for COVID. And we are seeing a rise in sickness that results in death across the state. Those numbers, what day they're counting them on, or precisely what they're apparent to all now. individuals that are really dedicating their work to recognizing these signs and signify, and we're using this to help us make good decisions about what we do in our daily lives. Stated press conference and the social distancing, and of course the hand wash. Even for the flu, we know that this is going to help us very much as well. For those that are crossing borders in the state, crossing borders of country borders to another area, individuals may not be masking or may not be social distancing as much. Even if it appears to be sanctioned in these areas, it doesn't make it any safer for us to do so. The virus has no knowledge of what people's perspective is. It just needs one more host and one more host and one more host. Do not be generous. We are reporting 4,902 new cases in Illinois for a total of 60,159 confirmed cases. Since yesterday, we have lost an additional 4 lives for a total of 9,387 lost lives. 2,463 people in Illinois were reported to be in the hospital overnight due to COVID-19, and of these, 525 patients were in ICU, and 212 patients were on ventilators. In the last 24 hours, almost 81,000 lab tests were reported, for a total of more than 7 million tests. We encourage people to get tested, and anyone can be tested with or without symptoms now at the state community-based testing site at the Jackie Joyner Cursus Center right here in East St. Louis. I was thinking about what closing remarks would be most helpful for anybody that is listening, and I was listening to the good words of our governor as well, who has been very dedicated to this, along with Dr. Ezike and so many others. So what I want to say to you, and is something that I know that all of you notice. There are many places that we go, good things are happening. We see people with their masks on, we see people keeping their distance, and we see people being very, very careful. But there is, if all of us think about the last 30 days of our life that we have been to, where that seems to disintegrate a bit. It seems to fall apart. Even for some of the same people that are practicing it, they will find themselves in spaces where they are beckoned into it not needing to be necessary. And these are often some of the places that we gather. It is really important that when you enjoy one another's company, that you do it very, very safely and you practice these things. And even small groups we know can transmit COVID if they are from unrelated households and the masking and the social distancing are not taking place. If you look on the travel map on our website right now, and I just made sure I looked right before in here, there are approximately 30 states that are hot spots right now, and almost 40 nations that are hot spots next to each other. So this we go in the morning to entering our home at night, and all the places we go somewhere ourselves. It is not only about protecting ourselves and our family, but so many people that we don't know, we connect ourselves to opportunity to help so many people that we don't know in the very best way that we can. So
next, that's right. Next, we'll call.
Hi, my name is Dr. Omar Badaman. I am the infectious disease specialist and an epidemiologist, Memorial BJC Hospital healthcare system. I have been an infectious disease specialist for approximately 20 years, and I've been serving this community for approximately 19 years, and I have been with Memorial Hospital and now BJC for approximately 15 years. This is a very interesting time for an infectious disease specialist, and in my career I have not seen, and I don't think I will ever see, hospital most cases of COVID-19 infection March 11th, 2020. Since then, we have provided care for approximately 1,001 cases. And unfortunately, we have lost 80 of our community members. And not only that, this infection has touched everybody in the community. The Memorial family really mourns the loss of one of our great colleagues, Dr. Edward Rose, who served this community for approximately 35 years as a rheumatologist. When I first moved here, he was the one who showed me the ropes around here. And he's greatly going to be missed. So this pandemic has affected and touched everybody else's life, not just in St. Clair County, but all over the country. And it's not over. We have more fighting to do. Our BJC group are committed, whatever comes, to serve the community. And can provide, but the community has to pitch in. That has to be fought by everybody. It's not the healthcare providers. If the patients end up in our hospital, we have already lost half the fight. So the next step is to prevent this pandemic from spreading. And I won't be too long, but there's 4 things I really want to emphasize on. The most important thing is masking. There is no argument about whether masks work or not. Not anymore. Masks work. They protect, wear it as much as you can. Picking up your kids from school, wear it as much as you can. I have been wearing this mask since March, and it's gotten to the point where I wear it so much I forget it's there anymore. Occasionally, so the community can help decrease the spread of this virus and get our numbers down by masking. And we decrease the transmission of the virus, then we can safely do what we need to do to open up our community. Number 2, keeping your hand clean. Yes, this virus is normally transmitted through respiration. We can infect ourselves. Number 3, distancing. Distancing from everybody. But number 4, the most important, and congregation. That is going to be an issue beside masking, controlling this virus. The weather is going to get cooler. We're not going to have the luxury of staying in open space outside. So the longer and the closer we congregation and the Christmas. And this is the time we're found cut than congregating in big number. Number 5 is influenza. We already are in a pandemic, and we don't need a twin-demic. We know I pushed influenza vaccine on my patient for 20 years, and sometimes patients will tell me, no, I don't believe in it and I don't want it. I'm young, I'm healthy. But this year it's very important because care system is taxed to the maximum. We have bed shortage. We need those beds for other problems. So really, if we have influenza coming in with COVID, with the colder weather, healthcare system is going to be overwhelmed. So I really want everybody to roll up their arm and get that influenza vaccine, even if you don't believe in it this time. So the two important things, masking, the vaccination, and preventing.
Line is Myla Oliver Blanford.
Good afternoon. I'm Myla Blanford, the Deputy Director for St. Clair County Health Department. On behalf of our Executive County Board Chairman Mark Kern, Jay Hoffman, I would like to thank Governor Pritzker as well as Dr. Tokar in our region. Continue to see an increase for positivity rate is at 7.8%, and the county rate is at 7.6.1%, and the St. Clair County daily rate was at a resurgence of mitigations. Everyone wear their masks, wash their hands, and social distance, as well as stay home when you're ill. Flu also mirrored COVID. We also know that family gatherings, and we see an increased incidence in respiratory illness during those times. We need to take protective measures to community residents. Testing is an essential component of fighting the spread of COVID. Widespread testing may be unknowingly spreading disease. Testing compared with contact tracing and reducing disease transmission in the Health Department has partnered with IDPH and Southern Illinois Healthcare Foundation to bring testing sites. They rotate throughout the county to give all county residents access. Today they're at the Belle Claire Fairgrounds from 8 to 4. This weekend IDPH will be at Belleville West High School from 8 to 4 on Saturday and Sunday. In addition, JJK Center is open Monday through Sunday from 8 to 4 o'clock. In addition, in our county, we have Southern Illinois Healthcare Foundation that has a static testing site on West Main. We have Walgreens, MedExpress, CVS, and others that offer testing, and you can look at the St. Clair County Health Department website, as well as our Facebook page for additional you to look at the St. Clair County EMA Facebook page to the county. It kind of presents a pulse of what is going on to watch that. As I alluded to, reduce the disease transmission throughout our community. When the health department receives a employed by the health department, identifying those contacts so we could remove the receive a call from one of our having correct information is the only way that are identified throughout their 10-day or 14-day period. And this is a HIPAA protected all of the. With that, I'd like to turn it back over to Governor.
A little bit more about the school data that's going to be available, information it's going to include, when it's going to be available, if it'll be available by the time and how it's going to break down the.
I don't have those details for you yet. The department is working on how it will present the data and exactly what data will be presented. They're trying to want to make sure that we're as transparent as we possibly.
Today in our area, we're looking at about a 20% threshold for med-surg availability and 32% on ICU bed availability. I don't have the statistics yet for today before coming over here. Okay.
And is that two levels of concern at all? Is that higher than it's been in the past?
It is slowly increasing. Okay. And obviously any increase is a concern.
So I can tell you that one thing just to offer to you is that we provide a reasonable amount of data. It's about 2 to 3 days, lag time for each region of the state. And so you could look up, for example, the whole Metro East region, and you can see on there what the percentage of med-surg beds that are available and the percentage of ICUs that are filled. And obviously we watch very closely. We have a kind of a red alert that comes online when you hit essentially 20% vacancy or less. And so we watch very carefully to make sure that regions aren't hitting that, and if they are, then there are things that we can do. We don't want to get to a point where we're reducing elective surgeries. Some elective surgeries are not as elective as you might think, and delays in those we don't want to cause. But that is kind of the fail-safe thing that we could do if beds start to fill up in any particular region and we need more bed space.
We're obviously less than 2 weeks from the additional restrictions being lifted and indoor dining is allowed, and that was a huge relief in the Metro East. But if we're, like you said, we're picking back up and businesses are really worried about being shut down again, and we already saw a fair amount of businesses not complying with their additional restrictions. I mean, what can we expect as far as will there be a tougher crackdown if they're not complying with the rules this time around? And also, how are they expected to deal with this seesaw of restrictions going back and forth?
Yeah, so let me be clear that we're not there yet. I know the question was about whether Region 4, where I'm standing right now, Metro East, which was in mitigations and is now out of those resurgence mitigations, whether, will people follow the mitigations if we go back into a resurgence mitigations? I think that's fundamentally your question. And what would we do to enforce it is the other part of this. So there are several things that I want to point out, which is we don't want any of this, we don't want any region to fall into resurgence mitigations. We're trying to keep you out of it. Well, that's one of the reasons I'm standing here. I want people to wear their masks. I want people to follow the mitigation rules that are in existence and not wait until we have to put resurgence mitigations in place. And so I'm pleading with everybody to please follow these. They work. Wear a mask. wear a mask. Keep social distance. I mean, you keep hearing us say it. I'll try to do it in interpretive dance for you sometime, if that will help. But the truth is that it really does work. And you all have done it here. I mean, and you can do it again. People kind of relax when they think, well, maybe things are better, the virus is going away. The virus hasn't gone away. In fact, in some ways, you could say the virus is never going to go away. We may get a vaccine, and we may get great treatments. But like the flu, for example, it's not like it just goes away. So as far as enforcement, look, we are now seeing the entire state is moving up in terms of hospitalizations, in terms of ICU beds, ventilators, and death, not to mention the cases where they all begin. And so we are being very serious and very focused on having the state police not only issue warnings, but also issue citations if necessary. We are asking state's attorneys to simply follow through on those citations. Those are monetary citations. We also are we will look to remove people's liquor license and their gaming license if they will not follow the resurgence mitigations that get put into place. And this is not something I have wanted to do before. I think I've been reluctant to do this before because it has this very serious implication for the future of a business. I want businesses to stay in business. I want them to survive. That's why we have these DCEO grants that we're offering. It's why we've tried to be careful about the types of mitigations we put in place, even for bars and restaurants. We're not immediately trying to close indoor service. As you've seen, it's a limit on capacity and so on. But it is very serious right now, folks, and if we need to close down restaurants and bars or take away their liquor licenses, take away their gaming licenses, we will do that because we are now headed into a peak that is beyond potentially where we were in March and April. I think you're hearing that on national television. You're seeing it in our surrounding states. Wisconsin built out not just one field house, they're looking at multiple field hospitals, rather, because their hospitals are full. We built them out in the spring because we thought perhaps we would end up in that situation. Thank God we were able to flatten the curve back in the spring. But now you can see, just look at the curves. We're working very hard, but we need everybody's help in the public. We need the restaurant owners and bar owners to follow the mitigations and to stop fighting and trying to find some flaw in the data, trying to find somebody who will say that a bar or restaurant is not a spreading location. The truth of it is, and I think every infectious disease expert that I've talked to, and dozens and dozens of studies, and I've held them up at the press conference yesterday to show they exist. I've sent them out to all the legislators and all the elected officials, anybody who's asked for them. Bars and restaurants are seriously places where spreading takes place. They're one of the top places that spreading takes place. It is true that private events, weddings, and gatherings in your own home where you're bringing in neighbors and friends and even family from, that you don't see often, when you bring them in your home and you have even a medium-sized gathering of people who you don't really know whether they have coronavirus, you don't live with them every day, these are actually the number one spreading locations. And so we want to address as many of those as we can. It's up to you to address those at home. We're doing what we can in the public sphere. We've got to get through this winter. We are not even in winter yet. So please take this seriously.
We'll do one more. Governor?
Yes, sir.
To follow up with what you just talked about.
Yep.
Obviously, this is very serious for a bar or restaurant. Would they lose the license temporarily or permanently? Could you clarify what that penalty is?
My point was that if we have to go remove somebody's license, it is a long process to try to get it back. So when you say temporary or permanent, that's not a decision I'm making. But if people are going to force us because they won't follow the mitigations and they're going to let people get sick in their business, then we're going to take this very seriously. If we have to stop them from doing business because they're helping to spread this disease and get people sick, then that's what we're going to do.
In Regions 7 and 8, they're actually posting online names of businesses that are defying the order. So,
Well, good.
What do you say to
Then
them?
what I say is to the public that lives in that area, now you can go look apparently at a list
Correct.
of places that are not following the rules. You don't want to go there. That's where you're most likely to get COVID-19. Don't go there. We also are going to use lists like that. I'm sure that the state police will go visit locations in Regions 7 and 8. They may use information like that to go to exactly those locations to see whether they are, in fact, scofflaws, whether they are following the rules or not, and will be issuing citations and or taking stronger action. So.
So McHenry County officials are questioning how regional positivity rates are calculated, and has pushed back with the page because local staff show a small percentage of outbreaks there are tied to bars and restaurants. Is there a communication breakdown with local officials, and if so, what are you going to do to address it?
No, the communication breakdown is with the people that are spreading these lies. Let me be clear that the way contact tracing works is once you are tested positive, you get a call from a contact tracer. Contact tracer asks you, where were you in a certain number of days before you went to get your test? Where were you on the day you got your test, and where were you subsequent until the time that you just heard that you are tested positive? All those locations are taken down. Among the top locations identified by people who are contact trace are bars and restaurants. And I think if you just think of your own life and places that you go during the course of 5 or 7 days, one of them is likely to be a bar or restaurant, for many people anyway. And so what we see is that that is a place that people go. That doesn't mean, but that was the location of an outbreak. That means that you were at that location, and those are locations where people are not wearing their mask, and they're drinking or eating and sitting together and with other people inside for perhaps an hour or 2 hours. And if you're drinking, sometimes losing your inhibitions in the process and maybe not putting your mask on when you really should be. And so that's just one of the many reasons why bars and restaurants are spreading locations. But don't believe me, I'm not a doctor. You should seriously look at all of the studies that we've put forward. You can Google them if you'd like, but we've provided them to the public. We've provided them, happy to provide them to any of the reporters. In fact, I think we've sent them out to virtually everybody. I hope that you'll at least refer to them in your articles. But it's very important for people to recognize that in any given county, what they're reporting about locations that people have been in the last 7 days or what have you is not necessarily, what they're reporting is not necessarily where people have been in the last 7 days, but rather where the outbreaks have taken place. And you can only identify an outbreak in a particular location if you know that multiple people in that particular restaurant, for example, or bar, ended up getting COVID-19 and reporting that that was a bar or restaurant that they went into. Many people may have gone to that bar or restaurant with COVID-19 or gotten it at the COVID-19 at that location and gone to other places, including their work. And other people at work may have gotten, and that will be the outbreak location, where it's being spread in a single location identifiable by a number of people as that specific location. So I think before I close on that, because I really think this is an important question, people don't seem to understand this, and they want to take one, minor bit of data and try to blow it out like it's proof of, bars and restaurants are not spreading locations. So I would like to ask the Assistant Director of IDPH to come up and at least expound on what I've said.
So just a little bit about contact tracing. The primary purpose of contact tracing is for disease containment, and as Mila was saying, on this reduction of spread and transmission, that's really what we want. There is a secondary piece of contact tracing that is very important, and it is the surveillance piece where we can see some correlations, sometimes some very rich correlations. It should not be mistaken for causality, but these are very important correlations, and they are different from the outbreak reporting that we also see, but they're important things to look at. But you will not see everything that you want to know in that data. We have to really expound on what's in the literature, what we know we need to do, and the literature is really very, very much in agreement about social distancing and masking. In fact, the more recent literature really talks about the importance of that being done simultaneously for sufficient safety. And of course, that's around people that we don't think are sick. So we look at the literature, we look at outbreak reporting, we look at contact tracing, but if we knew where every single outbreak was, we would not have a pandemic. So these are very good questions, but I just want to explain a little bit more about the role of contact tracing, and that it doesn't tell us everything, but it tells us some very important things. Thank you.
Thank you, everyone. Thank you.